Okay, I'd like to go ahead and get started. I would like to welcome everyone to the 8th meeting of the House Standing Committee on Health Services. Thank you all for being here. We are going to go ahead and call the meeting to order. DJ, please take the roll.
Representative Bentley.
Yes, sir.
Representative Bratcher.
Here.
Representative Bray.
Present.
Representative Burke.
Here.
Representative Callaway.
Present.
Representative Camuel.
Here.
Representative Duval.
Here.
Representative Frazier Gordon. Representative Justice. Representative Neighbors.
Here.
Representative Rayburn.
Here.
Representative Raymer.
Here.
Representative Riley.
Here.
Representative Rorks.
Here.
Representative Sharp.
Present.
Representative Wilner. Representative Whidden.
Here.
Vice Chair Dotson. Chair Mosier.
I am here. Okay, we have a quorum established to do business, and once again, welcome. We are going to go right ahead and get started on House Bill 11. I'd like to have Representative Raymer just introduce yourself and your guest for the record, and we're going to try to keep this contained to a time limit because we do have a full agenda. So, and I know that there are some other guests who will be speaking. So please proceed.
I'm Rebecca Raymer, representative for District 15. I'll let my guest introduce herself.
Good morning, Madam Chair and members of the committee. Christy Trout Van Tatenhove, legal counsel to the Speaker's office.
Thank you, Madam Chair, for hearing this bill, and I will be brief because I know there's other people that want to speak on it. But House Bill 11 is about vaping, and this started out because I was contacted by school officials in my district, and I know other representatives have been contacted as well about how rampant the vaping is in our schools. And as I dove into this subject, what was being confiscated in the schools are mostly flavored and disposable vapes. And then looking further, I found out that these vapes are really not even supposed to be offered for sale per the FDA. So in 2016, Congress granted FDA the authority to be the regulatory authority on vaping products. There was a huge backlog of products that they had to go through. So there is some definitions, and that's why I'm going to let Christy speak on some of the definitions briefly, but there is a definition of that the products have to meet to be on the shelf. So now what you're going to hear from the people that are in opposition of this bill is that it's going to take everything off the shelf. That is just simply not true. There's other states that have used the same definitions that we are using. I think Alabama is one of the states, and they have about 1,600 products on their registry of things that can still be sold. And I've also talked to my Congress Brett Guthrie's office. They know that this is a problem. There is lobbying efforts going on at the federal level to get the FDA to work through these products so that we have a very concise list of what is legal. But we are not the regulatory authority over these products. We don't get to decide what's legal and illegal, just like we don't get to decide which prescriptions are legal and illegal. The FDA is the regulatory authority over this. And I'm going to let Christy briefly talk about the definitions.
Would you like to adopt the committee sub?
Yes, let's.
All right, we have a motion and a second. All in favor of adopting the committee sub, please say aye. Any opposed? Okay, thank you. Now, please speak on the committee sub.
Sure. In terms of the definitions, can you hear me okay? Thank you. In terms of the definitions, I think Representative Raymer is referencing the Safe Harbor certification section in the committee sub, and you'll find that starting on page 2. That Safe Harbor certification definition and the subsequent subparts are intended to define the products that the FDA has identified as a safe harbor, that they can still stay on the market even though they may have not fully been authorized. The FDA's language is authorized to market. So these sections represent the different pathways to market that a product can have if it is a nicotine-based product, whether it's tobacco-derived or non-tobacco derived. And that's what you see in those 3 separate subsections. So you'll notice for a product that was on the market from a date certain to another date, its application had to be filed by a time certain. If it's pending review but hasn't been denied, or if it has been denied but that company manufacturer has filed an appeal to either the FDA or a court of competent jurisdiction, then that allows that product to stay on the market until there's been a final action. That's the substance of those definitions. And if a product has that certification and and the manufacturer provides that to the retailer or to the wholesaler, then it can be on the market lawfully in Kentucky.
And so there are some penalties if a retailer is found selling to somebody under the age of 21. What the committee sub does is it actually puts the first offense on the clerk. The second offense and subsequent would be on the retailer, $1,000, $5,000, and then they would lose the ability to sell those products for 1 year. Now, if they are caught selling the illegal or unauthorized products, it's the three penalties, $1,000, $5,000, and then losing the ability to sell for 1 year within a 2-year time frame. Those offenses would have to occur. I'm happy. Do you want me to do questions now, or do you want to let our speakers?
We'll go ahead and bring up, I think there's some students here who want to speak on the bill, and we'll give them a few minutes, and then if there are folks who have any comments in opposition, then I'll bring them up, and then you can come back to the table. So just stay close, please. Make yourselves comfortable, and please make sure that your microphones are on by pushing the little button, and lights on, pull it close, and introduce yourselves for the record, please. Welcome.
Thank you. My name is Griffin Nemeth, and I'm the Youth Advisory Board Coordinator for #Icon in the Trend at the University of Kentucky.
Good morning, or good afternoon now. I'm Britt Anderson. I'm a pediatric emergency medicine physician.
Good afternoon. My name is Mallory Jones, and I'm a junior at George Rogers Clark High School in Winchester, Kentucky.
All right. Thank you, Madam Chair and members of the committee, for the opportunity to speak today. We have a youth nicotine use crisis in our state, and I think that Representative Raymer made that clear. Now, over the past several years, Kentucky lawmakers have taken steps to combat the issue, including raising the minimum legal sales age to 21 in our state, and with the passage of the Tobacco-Free Schools Act in 2019. Now, with House Bill 11, we are seeing increased measures to protect Kentucky kids and to ensure that retailers are held accountable for selling to underage youth and for contributing to the youth vaping crisis. Now, between the three of us here, we probably have more experience with this crisis than most. And that is unfortunate, but preventionists, medical professionals, and youth alike are concerned with the increasing use of these products among youth in our state and across the nation. I'm hoping that you'll hear this in our testimony today and consider our experiences and shared expertise to increase the specific measures to protect Kentucky youth, which at this moment in the bill could be increased. And so now I'd like to turn it over to Dr. Anderson to share her expertise and experience.
Thank you so much for allowing me the time today to speak in support of this important bill. Like I said, my name is Britt Anderson, and I'm a pediatric emergency medicine physician and vice president of the Kentucky chapter of the American Academy of Pediatrics. My testimony today is based upon my personal and professional expertise and does not represent any official position of the University of Louisville or Norton Healthcare. Like many folks who work with children, I experience immense joy from considering the potential of kids. Even during a busy ER shift, I find myself examining and babbling with a little baby, and I try to ask every child and teenager what they want to be when they grow up. Oftentimes, my team is able to intervene to save someone's life so that they can grow up. And tragically, sometimes we are powerless to stop something dangerous, which is immensely humbling. While I cannot speak to the lives of my young patients, I do bear witness. It breaks my heart to see young people already addicted to nicotine products. And let me be clear, nicotine, even in an electronic cigarette or vape, is highly addictive. These are not evidence-based cessation products. After everything that we know about the dangers of nicotine, in 2024, I frequently see kids with vapes in their pockets, coughing and wheezing. Kids who can't exercise because they can't breathe. young people who have a history of serious asthma, who require ICU level admissions on multiple occasions, who struggle to stop vaping. And when I talk with young people about vaping, I hear the misconception that e-cigarettes are not dangerous. They're flavored, they're widely available. How bad can they be? Well, we don't know all the long-term outcomes of vaping and these products on young people's health, but we do know that they cause lung injury and changes to brain development during a crucial stage of life. And it's not just the nicotine. The complete ingredient list may contain fine particles and other carrier solvents that are unhealthy as well. And this weighs heavily upon me. Talented, kind, young people addicted to nicotine products already in the ER. And when I look at these kids, I see so much great potential, but I worry about a much harder road ahead for them. This is not cutting-edge science. We know the dangers of nicotine. We can do better to keep the next generation healthy, the generation that will be caring for us. Given what we know about developing brain in adolescence, that it's a period of high impulsivity and experimentation, the onus is on us as adults to protect young people from these dangers. I will keep at it in the emergency department, but you can do more by passing reasonable policy to protect kids. Please protect kids and pass this bill. I thank you for your time, and I'm honored to turn it over to Mallory Jones.
Like Dr. Anderson said, my name is Mallory Jones, and I'm a junior at George Rogers Clark High School in Winchester, Kentucky. I'm also one of Vice Chairman Dotson's constituents. I'm here today to talk about House Bill 11 from a student perspective. Vaping is a big concern among the youth of Kentucky, impacting our schools and our communities. I've personally seen the firsthand effects of vaping. Walking through the hallways or behind the stairwells or in the bathrooms at school, I've witnessed my peers use and abuse nicotine and tobacco products. In fact, 1 in 5 Kentucky high school students reported using e-cigarettes in 2023 alone. A big reason for this is that it has become a trend amongst the youth. 61.5% of Kentucky kids report that they borrow nicotine products from someone who is also likely too young to have obtained these products legally. It has become a trend and seems like the cool thing to do. Once one person in a friend group starts using e-cigarettes, word gets around of where you can buy these products illegally, and it spreads like a domino effect as more and more people try it. Even as someone who doesn't use these products, I am at risk of the damaging effects through secondhand exposure. I personally have a congenital heart defect, and by being around the vapor from these products, my heart health and my well-being is put at risk. Introduction to and initiation of these products does not fall solely on youth. We are being marketed to. These places are advertising nicotine products as fun and safe. They use bright colors, and they use flavors that appeal to kids, and they also don't advertise the harmful effects of using these products. Most adolescents falsely believe that these products are safe. Some don't even realize that they contain nicotine. But they can deliver very high concentrations of addictive nicotine, hooking the user who can become dependent on it. Beyond that, it is becoming easier and easier to acquire such from a local shop or gas station. I personally live in a smaller town, and I'm aware of multiple different places where my peers can purchase these products illegally, even though they are all below the age of 21. I know this isn't just a problem in my community, because nearly 1 in 4 Kentucky students have reported being sold these products, and it doesn't just include high schoolers either. Kids as young as middle school have reported being sold or using nicotine products. Kentucky is one of only 10 states that doesn't have a comprehensive program to enforce tobacco 21 laws. However, Kentucky high school students' e-cigarette usage has surpassed that of the national adult rate of traditional cigarette use. It is an adult responsibility to protect kids from the harmful effects of nicotine and keep these products out of the hands of me and my peers. We applaud the sponsors for bringing a bill that specifically prohibits citation or arrest of youth and does not punish kids who are the victims of this marketing tactic. Addressing the source of these products is critical to reducing youth access and initiation of nicotine, but the rules are only as good as the enforcement that we put behind them. I appreciate your time today and ask that you please take action. I'll turn it back over to Griffin.
To reiterate what Dr. Anderson and Mallory have said, there is a youth vaping use crisis in our state. Now, although House Bill 11 will not afford us the opportunity to join the other 40-plus states that already have some form of comprehensive tobacco retail licensure, it will allow us a more complete understanding of the retail environment. That is, who is selling these products and where they are located. Now, to further strengthen the Tobacco 21 enforcement in our state, however, regular compliance checks are needed to ensure that retailers can be held accountable and that bad actors can be penalized for selling underage to youth. Now, it is important not only to know where these retailers are located and where these kids are getting their products from, but it is important to make sure that we can act and intervene before those underage sales occur. It is with and only with the three combined elements of a retailer database, compliance checks, and stiff penalties for violations that we can implement comprehensive prevention at the point of sale. I want to thank you again for your time today, and I strongly encourage you to act to protect our youth.
Thank you so much for being here today. I really appreciate all of your perspective, and I think it's helpful in really trying to understand what the situation is and what we're trying to do here. So thank you for being here. I don't see any questions for you all right now, so you can just stay nearby, I guess, if there are any. And I do have a few folks who have signed up in opposition. We have, I'll just ask you, there are 3 names, so I'll just have you all come to the table together and let you have a few minutes each, if that's okay. We have Troy Leovac. If you signed up, I may be getting your name wrong. Mike Reichert and Tommy Wilson. If you could just introduce yourselves for the record, please. Tell us where you're from and who you're representing, and proceed.
Sure. My name is Troy LeBlanc. I have stores throughout Kentucky and Indiana. I also manufacture product here in the state of Kentucky for roughly 58 countries. I'm an electronic retailer, wholesaler, and distributor in the U.S.
Thank you.
My name is Mike Reichert.
Is your microphone on?
Check. Hello. Hey. My name is Mike Reichert. I own 2 vapor shops in northern Kentucky.
Hello. My name is. Sorry. Good morning. Thanks for having us. My name's Tommy Wilson. I own a vapor store in Pulaski County and one in Wayne County as well.
Okay. Thank you for being here. You all decide who wants to go first.
Go ahead. So I had a bunch of things prepared, but the one word that kind of threw me off was the word opposition. We're not really in opposition. In 2019 was very difficult for us. It was when Juul came out, and all you saw in every high school was Juul, Juul, Juul. All you heard all over the TV, radio, news, Juul, Juul, Juul. All the kids are using Juul. And it dawned on me, that's when electronic cigarettes started being sold in mass quantity in convenience stores. Here, I have a list of the 2023 bad actors. There's over 300 people that were caught selling to minors this past year, 4 of which were vapor stores. The rest, convenience stores, C-stores. We agree with you. We want to do something with youth. We want to raise fines. I don't think 1,000's enough. I think 5,000, 10,000, 25,000. I think that's going to get the message across. However, the bill that we have currently, I know it means well, and I know the purpose behind it. I don't believe is the right bill, because all it's going to do is going to make sure that Altria is the main seller in every convenience store in the entire city, which is Juul. And Juul is going to be all over the state. Juul also does not offer any nicotine product that's lower than 30 milligrams per milliliter. The average nicotine sold in vapor stores is 3 milligrams per milliliter. I strongly urge you all to reconsider this, not just for the 450 different vapor stores throughout the state that are doing the right thing, because they're not the ones getting caught selling to underage. And I urge you to change this bill to put these products in 21 and over stores and have them policed by the ABC and have them fined with major fines so that anybody who's caught selling to a minor, I agree with you all 100%. I don't want to see it. You all don't want to see it. So make sure that the fine hurts enough to where people will not do it. However, banning a bunch of products, I'll show you, you all each got a handout. And this is a store that I own. If you go on page 3, everything on the left, I know there was testimony here a moment ago saying that there's 1,600 flavors left in Alabama. And, you know, I distribute to Alabama. I'm a legal distributor in Alabama. I can tell you that it's not working there. On the left, everything in red that is going to be banned off that shelf, if you look on page 3. On the right, everything that's green is everything that's offered in a lower milligram nicotine. 3 milligrams, 6 milligrams, 12 milligrams. If you go to the next page, a competitor. Again, everything in red is everything that's going to be banned as of January 1st. If you go to the right, everything in green is everything that is going to be offered at a lower nicotine. The whole point of an electronic cigarette is to start at a certain nicotine level and to work your way down. Something that Juul does not offer. Here you have a gas station. Everything on the left, going to stay legal. Juul, RJ Reynolds, you might know them as Camel cigarettes. All their products still legal. Not a single one of them has anything under 30 milligrams per milliliter. Not a single one of them offer them an option to go to 12, to go to 6, to go to 3, and to work their way down on nicotine. So I urge you all not to punish the 4 people on this list that were the bad actors last year. Put these in 21 and over stores and don't let them get to the other 297 that will still legally sell all the products that you saw on that 4th and 5th slide. Thank you.
Excuse me. Thank you, Madam Chairman and members of the board. Again, my name is Mike Reichert from Campbell County. Troy's right. Most of the products that I sell would be banned as this bill is currently written. It would almost certainly cause both of my stores to close. But that's honestly not what's important here. I just want to tell you about one of my customers who's been with me for 10 years, George and Rosie. They're now 76 years old, and they started smoking cigarettes when they were 14 and 17. Over the years, George tried to quit repeatedly. He made it for a couple weeks here and there. Rosie was never, ever able to stop for one day. In 2014, they went into a gas station and they bought an expensive vape. But they thought, you know, this isn't bad. It might actually work to get me off of nicotine. So in an effort to save money, they came into my shop. And since that day, 10 years ago, they have not smoked a single cigarette. George would tell me about how, you know, when he would cut his grass, he would have to take a break right in the middle of it because he was so winded. He'd have to stop and sit down. Same thing happened to me before I quit. And then once after a year of vaping, he can go right through it, no problem at all. 10 years later, at 76, their lungs, not their knees, but their lungs feel better than they did 10 years ago. Currently, George and Rosie buy 90 milliliters of nicotine juice from me each week. They pay $20 for that in my store. If they switch to the Views product or the Juul product that this bill leaves on the market and protects, it will cost them between $150 and $300 per week. They're not going to do that. They're going to end up going back to smoking cigarettes, and that is probably going to kill them. We do not sell vapor products to anyone underage. One of the state troopers that keeps this very building safe is one of our regular customers. I got into this business to help adult smokers quit tobacco. Like he said, all these warning letters. I won't say that again. But I will tell you this. I also know of plenty of stores that will sell to literally anyone, and I'm talking 14-year-olds. I know exactly who they are. I've reported those stores to my local police. I've talked to the mayor. I've even talked to the state tobacco control agency, and nothing has been done. If you really want to fix this problem, like Troy said, the first way to do it is to get us into the just 21 and up stores. But the main thing is enforcement. I'm glad to see that in this bill we've got those fines, but I agree with Troy. They should be higher. They should be massively higher. And put the bad actors out. We're out here trying to protect adult smokers. We do not want youth smokers. I've had people that come into my store, there were friends of mine when I first opened, and they weren't smokers, but they wanted to support my business, and they're like, oh, let me just get something with this. I was like, no, this is not what this is for. But yes, there are bad actors. I urge you to stop them, and if you alter this bill, maybe we can do that. Thank you very much.
Hello again. Thank you, Madam Representative, and all you representatives for listening to us today. So again, I'm Tommy Wilson from Pulaski County. I too own 2 vapor stores, and I too want to address the youth issue. I know that's important to everyone, and it is to me. I have grandchildren. I don't want them vaping. I don't want them smoking, right? But as my colleagues both pointed out, and I agree with, if you guys would understand how passionate a vape store owner is. Now there's people that sell it in any store, right? But when this started in 2010 to 2013, started exploding, 75 to 95%, I'm going to say, of vape shop owners were former smokers who found vapor, and it was so good and got them off the cigarettes that they had been trying for years to quit, that we went into business trying to help others. And in my county, I have had many people tell me many times, your store's the hardest in town, man. You all ID too much. I agree. And we're going to continue to do that. So my point to you guys, and what I would really like you to consider, is the passion that vape shop owners have for this industry. We saw that this is a way off of combustible cigarettes, which contain 3,000 chemicals, and we wanted to be a part of that. And I've helped over thousands of people get off nicotine via combustible and get a lower dose of it via vapor. And then some of them have even got all the way to 0 and completely quit, which is the goal. We're the only industry that I know of that we're saying, hey, we want you to quit doing business with us. We want to help you not do business with us. So we are very passionate about it, and I totally agree that the standalone vape shop, over 21 gated, you don't go in unless you're 21, vape shop owners that are as passionate as we are carding. The first 3 years I was in business, I'm going to say, we probably turned away 5 to 7 a day of youth coming in. We would card, sorry, we cannot sell to you. They would leave. Now, I bet we don't see 1, maybe 2 a week, because the word has got around. They know that we're going to card them because we care about this industry. We too don't want youth vaping. But that said, we feel like it's an adult's choice to be able to find something that they deem less harmful to their body. And each and every one of us that are vapors, that's exactly what we've came up with. Is it perfect? Maybe not. Is it better than 3,000 chemicals and burning smoke going into your lungs? I feel it is. So I'm asking you to please consider the 21 standalone vape shops, and I think you'll see this issue go away with the youth vaping. Thank you for having me.
Thanks. If I could just say, I sincerely appreciate you giving us all the time today, and just to touch on the Alabama, I'm happy to meet with any of you and show you the list of the 1,600 products. However, if you actually dissect it, there's only 8 brands on there of flavored nicotine. So, and I'm happy to meet with any single one of you and go through the 1,600 items and show you that there's only 8 brands on there that are legally able to sell. So thank you very much sincerely for your time.
Of course. Thank you so much for being here. We have one question for you all before you go, but I just want to say thank you very much for being here. I appreciate your professionalism and that you are trying to control vapes and keep it limit this to 21 and over. I would, of course, encourage you to continue speaking with the bill sponsors to get this right. No one wants to do anything that is going to put anyone out of business. That's not our goal, and I think you know that. So if there are tweaks that can be made, now's the time to do that. So stay in touch, and I appreciate your being here. Representative Bray.
Thank you all. Over here, sorry. So if I understand correctly, you all are selling products that the FDA hasn't authorized to sell. I mean, do I understand that correctly?
So to go more deeper into this, the FDA has chosen a discretionary They are authorizing and they are pulling things off the market at their own discretion. And full disclosure, there are lawsuits all over in all different federal district courts, one of which is probably going to go to the Supreme Court. It came out of the 5th District a few weeks ago in the Triton case. So you may see a full change. Furthermore, the Chinese product, I guess, that you're seeing come in, the FDA currently, in fact, as soon as the last 3 weeks, is currently seizing any container that comes in. They're seizing it directly at the border unless they have the PMTA. So I think the FDA understands the disposable issue, as do we, and they are acting on it. I just kind of wish that the state would let them continue the PMTA process because there are so many lawsuits brewing across the country, and us just focus on making sure that whatever's being sold here is being sold to adults.
Right. I mean, the products that they approved are basically just all the tobacco company products. I mean, there was like how many, like a million?
All of the challenges are based on the methodology they used to accept and not accept. Like, for instance, there are some companies out there who spent $1 million or $2 million on the PMTA application. I know one personally that spent $4 million. And there are companies like Juul who spent $130, $140 million on their application. So, it's clear that there's a bar set on the federal level that's prohibiting small business from obtaining proper PMTA, even though their product may not be very different than ours. I mean, I can dissect it in a micrometer for you guys if you all want to see, or for you all if you all want to see. But all the challenges across the country have a basis on the methodology that the FDA is using and challenging them that they need to come up with a better way to help small business attain the licensing.
So I guess I'm just kind of confused. If the FDA has the regulatory authority to list what can be sold or what can't be sold, and the products that we're talking about getting rid of are the ones that can't be sold according to the FDA, how are you all able to market those already anyway?
Because that's been stayed by a court, because immediately upon that decision, it was blatant to the court that this was that it wasn't a valid process, that you can't. I mean, think about it. We're talking about, I think it was around 1 million PMTA applications, and the very few that they said were approved for sale to market are exactly the products that are owned by the tobacco companies. They didn't approve. It was just a blanket. We're not gonna approve anything. So that's why it was stayed immediately, and that's why he's talking about all these court cases.
When he says stayed, there are a group of specific brands. Some of them are my close friends that have an actual stay who will be able to legally sell in the state of Kentucky. Not all brands. So, like I said, the FDA is doing it on a discretionary basis because they understand all of the lawsuits that are going on right now. And quite frankly, we don't know what the landscape is in 6 months. For all we know, Congress might come in and completely change the entire PMTA ruling in 6 months. So we're working on that in a federal level.
Madam Chair, may I? One
Quickly,
more.
I've got a long list.
I'm sorry. So if Alabama's adopted very similar legislation or used the definitions, have the vape shop, so there's not a vape shop to be found down there now? I mean, 99% of them closed.
So they passed the bill 2 years ago. However, they have zero enforcement of it. So right now, it's basically just everybody just continues doing business as it was 2 years ago. And in fact, our attorneys are working, because we actually have licensing to distribute into Alabama, my company that I own. Our attorneys are working with them to reverse the decision. We're working with Alabama currently to reverse the decision because they're also finding out that enforcing it is an absolute nightmare because there are so many different products out there. So enforcement's a huge thing in Alabama.
Okay, thank you, Madam Chair.
Of course.
Madam Chair, may I make one last point that I missed?
Sure.
I'll make it quick. So we were talking about earlier, some of the other folks that were speaking about flavors enticing children. Yeah. I do get that, but I also get, just like with alcohol, in a gated 21-plus store, you can walk in and buy cherry vodka, orange vodka, whatever type of alcohol-flavored vodka you want. And I'm saying the same thing about vapor. An adult has the right to choose what they want to put into their body as long as it's a legal product. And we're asking you to please look at the 21 gated stores. Thank you.
Okay, thank you. Representative Callaway.
Thank you, Chairman. Thankfully, Representative Bray did ask a couple of my questions, so I can ask a couple of the different ones that I had. I was trying to wheel it down. So, if I'm understanding correctly, your proposal, you're wanting to wait until some of the decisions about which products are going to make it through the FDA stay and all of that, those proceedings, those rulings, and the proposal is, in the meantime, keep it out of the kids' hands, put it in the 21 and older stores, the gated stores. But there's you guys don't have anything specific in regards to the high nicotine products. You're not mentioning those. Those are not on your list of concern. I mean,
we wouldn't be against taking away high nicotine items. However, I can assure you that Altria Juul will throw a fit about that.
Yes. They're the ones that set the bar, honestly, at the high nicotine level. They're the ones that changed it. But when we opened, I never had anything above 24 milligrams. And for the last few years before Juul started blowing up, the highest that most of our juices were 6 milligrams. They had even dropped to the 12 and 18 and 24 because so many people had lowered their nicotine. So yeah, I mean, I wish that never would have happened in the first place, but we're not the ones that did it. But then we kind of had to, I never wanted to carry any of the high nicotine disposables, but it got to the point where, that's what people were looking for because the tobacco companies had set the bar, and then there it is.
Yeah,
Thank you.
We're not against the nic cap.
No, not at all.
Not here.
Thank you.
Okay. Representative Fraser Gordon.
Thank you, Madam Chair Lady. This is a question for Troy, and again, it is in regards to that nicotine cap. So just a point of clarification, are you saying that if this bill were to pass, there would not be products available less than that 30 mark that you referenced? Or was it just an example?
We can, if you'd like, I can meet with you afterwards and go through the 1,600 products. Most of those are like nicotine pouches. There's a lot of that's hardware. I can see why they sent it out because it sounds like a lot, 1,600. I can go through it one by one and show you exactly what is low nic.
I just need a yes or no. Is there anything available less than 30 if this bill were to pass?
Will there be? Sure. Some of the stuff that are on a stay, but those are all pending a lawsuit. But everything that Juul and Views has out is over 30 milligrams.
Okay. Representative Bratcher.
Thank you, Madam Chair, and thank you all for your presentation today. Just a question: if I buy a vape, I'm right here. Okay. So if I buy a vape, how do I know all the ingredients are in that vape? Is there an outline that says everything that's in there?
Almost everything that has submitted a PMTA has submitted all their ingredient listings to the federal government. So anything that has a PMTA or anything that has a submitted PMTA has submitted ingredient listings. If you all would like, ingredient listings, there's no real way to, I guess, put the ingredients on the box. However, that's exactly why the federal government currently right now is in review of those products and on a discretionary basis pulling them one by one if they find the bad actors.
So if I'm wanting to protect the consumer, and you're telling me that I can buy a vape and I don't know what's in it, and if you're buying vapes and you're selling them from out of the country, then I have no idea what's in this vape. And so that may explain why I've got superintendents calling me saying a kid was taking a vape and had to be transported to the hospital because they vaped.
Right.
Sir, I think that goes right back to the nicotine. They're getting these at convenience stores, stealing them from mom and dad, whatever. But these disposables that Altria is putting out, the Juuls and the Enjoys and whatnot, they want the 50 milligram and the 30 milligram. In our stores, we're looking for ways and encouraging our customers. Let's start you at about 12, and then after you've done it 6 months, let's drop you down to a 6, and eventually get you completely off from it if you can. So I think when you're talking about carrying them out on stretchers and gurneys, I'm relatively certain that it would either be totally different from nicotine vaping. It would be illicit THC cartridge vapes, and or the high nicotine that you can get in the convenience stores. And as I said in my original statement, the vape shops are committed and passionate. The convenience stores, I mean, it's a money grab. They don't care. They're just selling it. We care. We actually care.
Yeah, I mean, most of the juices that I sell for refillable vapes, most of them are actually made right here in Kentucky. I'm some of the people in this building, so I'm sure they could give you the exact ingredients that are in it. I mean, pretty much all vape juice is basically the same thing. It's PG, VG, nicotine, and flavoring. Flavoring is really the same stuff that they use in cake batter or cake mixes and whatnot. A lot of that's made in Cincinnati. And that's what's disheartening about the FDA process, is that how can you approve a product that is made from the exact same stuff that this is, but this one's the tobacco company, so you're going to approve it, and this one, isn't. It's an independent company, so we're not going to approve it, even though they're honestly identical products with the exception of their crazy high nicotine rate.
And 3,000.
Thank you, Madam Chair.
Thank you. Yeah, this is a good discussion. I appreciate your input very much. I never want to inhale cake batter, so that was alarming. But it sounds like the vape stores who are carefully monitoring this bill the age restriction's not going to affect you, but it'll bring others into compliance, and maybe we can talk about some of the nicotine levels. Thank you so much for being here. I'm going to bring Representative Raymer back to the table. We have a question for her and allow you to wrap up the testimony.
Thank you very much.
Thank you again, representatives.
Of course.
So just to speak to a couple of things that they said, I understand that they don't like the FDA process. It was very difficult for us to weed through the FDA's process and their definitions ourselves. But the bottom line is that Congress granted the FDA the authority to regulate these products, not us. And this is the definitions that are in place. They are clear. I understand the FDA has a very limited enforcement arm. And so we as a state have an obligation to offer some public protection to our citizens. If we know these products are not authorized, they're not legal per the FDA, we shouldn't have them on the shelf. And then I want Christy to speak a little bit about some of the things that they said about the PMTA and the Triton case. Is that okay? Or whatever.
Sure. I think Representative Raymer asked me to talk about the PMTA. It's an application, not an authorization. And I think that's the key. And the bill creates an opportunity for those products that have filed an application that has been accepted for review by the FDA to remain on the market if it meets the other requirements of the safe harbor. So the FDA process, there is an initial review that may reject an application outright. So there'll be those that aren't even going to be considered by the FDA, and then there are those that are considered by the FDA. So they'll have that letter. And as part of the safe harbor certification that House Bill 11 provides, those manufacturers will have to provide proof of that document, that their product is in that process. It also allows for an opportunity for there to be a change at the FDA level. And so if there's a material change at a time certain, it allows that manufacturer requires that manufacturer to provide that information to the retailers and the wholesalers. So it's designed to mirror both the lawfulness of the product and the enforcement efforts of the FDA, which I think are two important distinctions, whether something's lawful and whether it's being enforced. And so the goal was to mirror both at the state level and provide that additional support. In addition, there is an effective date of January 1, 2025 in the bill that allows an opportunity for a lot of these other things that have been raised to percolate, if you will, through at both the federal level and at the state level. And for those shops that may need to be more compliant pursuant to this law, if it's passed, they'll have an opportunity to do that. And I believe that answers the questions you wanted me to.
Okay.
And one more point, they spoke about the vape shops not being the ones that are out of compliance with the under 21 sales. So we do not have a list of the vape shops that are selling these products because we don't do licensure of these products. So we reached out to the Department of Revenue to get a listing, and it was very obvious that we did not have a full list. So one of the things this bill does is when a business license with the Secretary of State, there'll be fields added to that process to ask if you sell this type of product. So within a year's time, we should have a more accurate list. But ABC did not have they weren't on the radar. ABC could only do checks when they got enough complaints about a vape shop that they would go in and do compliance checks. And I'm happy to answer questions.
Okay, thank you for that clarification. I have a quick question. So when the FDA is looking at these products, do they have the ability to use or to approve the lower nicotine products as well?
It's my understanding, and I'm not an expert in this by any stretch of the imagination, and apparently no one else is either, because this process has been really, really complicated. Even reaching out to the FDA directly, it was challenging to get answers and clarification. It's my understanding that they have complete authority over products containing nicotine, whether those are, however that is delivered, whether it's tobacco-derived or non-tobacco derived.
Okay, thank you. I appreciate that. We have a few questions, and then we are going to need to move on. Representative Dotson.
Thank you, Madam Chair, and thank you, Representative Raymer, for the hard work you put into this bill. I'd like to send a quick shout out to Mallory Jones. You've done a wonderful presentation today, and I'm very proud of you. Just for my own understanding, if a PMTA is submitted to the FDA, are they allowed, once that application is submitted, to sell product and await a ruling? Are they allowed to do that, or do they just have to wait to that ruling before they can sell?
Representative Dotson, if I may, Vice Chair Dotson,
Yes.
if I may, if you look on page 2 and 3 of the bill under the definition of safe harbor certification, it sets out the dates and the products that may remain on the market pending that application process. In addition, pending any court action or agency action were they to be denied.
Right. So what we're trying to do is bring Kentucky in compliance and mirror exactly what the FDA is doing.
Yes, sir. That's the effort.
Okay. Thank you so much.
Okay, thank you. Representative Rourks.
Thank you, Madam Chair. I just want to thank the bill sponsor for trying to find a solution that would help Kentucky's youth, seek prevention of nicotine products. I serve on Tobacco Settlement Committee, and of course, this is always an effort that we're trying to focus in on. I just wanted to ask a question around how will House Bill 11 begin to address the current vaping epidemic with our youth through prevention and discouraging the uses altogether?
Well, there's nothing really in here that strictly looks at prevention. It's really looking at the under 21 sales. Now, I know that we passed another bill. Representative Hart had one that looks at education in schools regarding vaping, because him and I talked about what his bill did and what mine did, and that's why he chose to focus on the education part of it.
Okay. Let's see. And then I just wanted to briefly make a comment on, I do still have concerns, though, that we may be creating a monopoly unintentionally, and I hope that those changes can be added to ensure that that is not, that it is very clear that those are not the case. Because I'm again see Juul and gas stations as definitely the source often of how we're subjecting our youth to these so frequently and often, as well as I have concerns that if we don't get it right now, we're just going to be back here in a year doing a cleanup bill. So I hope that we can continue to make progress to make sure that we're not just giving a couple of brands a monopoly on the entire industry. But I know that you've done tremendous work on this. I just wanted to thank you again.
I'll say that Big Tobacco doesn't like this bill. This was not a bill that was brought to me by an industry. This has been crafted from the ground up with us really trying to truly just mirror what we're supposed to be doing and what's supposed to be on the shelves per the FDA.
And the last question, Representative Riley.
Thank you, Madam Chair. Representative Raymer, basically, how does this bill deal with the enforcement part of this? I know ABC has been in charge of this. Does this now give local police more freedom to deal with this issue?
Yes, it does. It says local law enforcement can issue citations, and they would report those to the ABC for ABC to impose the fines.
Thank you. And one more real quick comment to Representative Rourks. I think Representative Wilner put an amendment on the school vaping bill that will deal with some of the issues that you talked about.
Okay, great, thank you. And I said last question, but I saw Representative Bentley raise your hand.
Thank you. I'm very short. Thank
Okay.
you, Chair Lady. The Tobacco Prevention and Cessation Program we already have in the cabinet, could we do an amendment or think about it? Because Jules already made 2 settlements, putting it into that for that prevention.
I'd be open to having those conversations.
Thank you. Thank you, Chair Lady.
Okay, you're welcome, thank you. Okay, well, seeing no further questions, DJ, please take the roll. Oh, we have, I need a motion and a second, sorry.
Motion.
We have a motion and a second, thank you.
Second.
All right.
Representative Bentley.
Yes.
Representative Bratcher.
Yes.
Representative Bray. Representative Burke.
I'd like to explain my past vote.
Go ahead.
Thank you. I'm grateful for this bill. I think this is moving in the right direction. I hope that the sponsor is open to continuing to work with all the stakeholders to make sure we do things like increase penalties for people who sell to people under 21 and look at things like nicotine caps, which I would definitely be in favor of. Thank you.
Representative Callaway.
Yes, explain my vote, please. I was going to pass, but I'm going to vote yes today. And I share concerns. I've voiced a little bit, but I do share concerns about the nicotine cap and the monopoly. Some of the things, I appreciate the approach that you took. I know you've been working on this for months, and so I guess I'm giving my yes in good faith that these concerns are heard, and we're going to address what we can going forward. But thank you again for aligning as you did with federal as we need to. Thank you.
Representative Camuel.
Yes, may I explain my vote?
Yes.
Thank you. I want to thank everybody who spoke today, and Representative Raymer, it's a great bill, and I really appreciate the work that you've done. We see it in issues with vapes in our schools all the time. And what I'm hearing from this is the universal goal is to get vape products out of the hands of minors. It's my goal as well. So one thing that I can say is, like, today's testimony is a great example of why committee hearings are so important. The testimony today really showed me that you don't know what you don't know. And so I learned a lot, and I appreciate that. But I think that there are some changes and tweaks that need to be made into the bill with amendments, and I think we heard some good ones mentioned up here.
Okay,
so today
you're
I'm going to
explaining
pass.
your vote.
Sure. So today
Okay.
I'm going to pass, but I can see how this would be an easy yes on the floor with some changes. So thank you.
Thank you.
Representative Dotson.
Quickly explain my vote, please. I want to thank you for the hard work again that you put into this bill, but I do have a couple little reservations. I'm all about the enforcement measures, but I am pro-business, so I'm a little conflicted on that end of things, but I am a yes to get it out of this committee, and I'm a yes for Ms. Mallory Jones. Thank you.
Representative Duval.
Yes.
Representative Frazier Gordon. Representative Justice.
Yes.
Representative Neighbors.
Yes.
Representative Rayburn.
I'd like to explain my vote, please.
Okay.
I appreciate the hard work on the bill. I'm going to be a no today. I do want to mention that I agree that we should penalize stores that are selling to minors. It's a major problem within our school systems and our youth. I do appreciate the work, but I'm a no. Thank you.
Representative Raymer.
Yes.
Representative Riley.
Yes.
Representative Rourks.
Pass.
Representative Sharp.
I want to echo the comments by Representative Dotson, though.
Representative Wilner. Representative Whitten.
Yes.
Chair Mosier.
Yes. Okay, House Bill 11 as amended by the committee sub passes with 14 yes votes, 1 no, and 3 passes. And the same should pass on the House floor. Thank you so much
Thank
for
you,
your
Madam
work,
Chair.
and thank you everyone for being here. Okay, next we are going to skip ahead and do another quick little bill. House Bill 829. I would like to invite the bill sponsor, who's already at the table. Thank you. And Representative Bentley will join you. Just introduce yourselves for the record and proceed.
Thank you, Madam Chairwoman. My name is Jason Nemus. I represent House District 33, which is Jefferson, Oldham, and Shelby counties.
My name is Representative Danny R. Bentley, District 98 of the Great Commonwealth of Kentucky.
Thank you for being here. Okay, we have a committee sub.
Yes.
I'd like to move adoption of the committee sub. Do we have a second? We have a second. All in favor of adopting the committee sub, please say aye. Any
Aye.
opposed? All right, thank you. We also need a motion on a House committee amendment. We have a motion and a second on the House committee amendment to the House committee substitute. All in favor, please indicate by saying aye.
Aye.
Any opposed? Okay, please proceed.
Thank you, Madam Chairwoman. So they have various technical changes, but I'm going to go through 8 changes in the bill and in the committee sub. But let me say by way of prelude, I guess. So we passed last year a medical marijuana bill because the sense of the legislature is it's important for our people. The House bill from a few years ago was much more in depth and we think had some more protections in it and some things that just worked better. And so we've incorporated some of those items into this. Also, to get a vote last year, I made a commitment that I'm at this table honoring, and that is to come back to the question and resolve an issue with respect to schools. And so I'm duty bound to be here and happy to be here to improve this this bill. So I'll go through the 8 changes. I think they're improvements. They're not restrictions in my view in any way that's uncalled for. First change in no particular order, just the order in which I have them down. First change on page 42. Language is added to ensure that local governments are permitted to establish and assess a local fee. So they're going to have to regulate it, obviously, with law enforcement and so forth. And so it allows them to have a reasonable local fee. Second change on page 41 and 42. It allows local governments. Now remember, so we're allowing local governments to opt out and the people to override that if they would. But we're saying if the city government opts out, they have to do so before cabinet gives a license in the area. We don't want them to give licenses, businesses up and running and pick your city, and then all of a sudden the city opt out. So they have the right to opt out, but they have to do so before businesses are up and running in their community. On pages 15 to 16, that's the school stuff. We're allowing religiously affiliated schools to opt out. We're allowing requiring public school districts to have a policy. And so if their policy is that they don't want to allow it, they can do that. If they do allow it, who's going to administer the medication? Is it going to be a nurse? Is it going to be someone else on staff? Is it going to be a parent? And so we're having the districts go through that and make sure that we have a pre-approved and standard process, so it's not willy-nilly and school by school and so forth and so on. So that's the school provision, again, on page 50. A requirement that the cabinet prioritize review of cannabis businesses that already have application, hemp businesses that are in good standing with the Department of Agriculture. The thought behind that is these businesses have already shown the government that they're legit, that they're properly capitalized, and they have the proper ownership and so forth that qualifies with criminal background checks and so forth. So if a business that's already in good standing, a hemp business that's already in good standing with the Kentucky Department of Agriculture, they get priority or first in line a quick review. And again, that is on page 32. On page 34 to 36, the authority and powers of the cabinet related to inspections and investigations of cannabis businesses of the license holders is clarified. This was in our bill for a number of years. It's there by implication in the bill that we passed last year, but we spell it out here to say that effectively, to make it easy in our minds, what authority ABC has to regulate folks who sell alcohol, that's the authority effectively that we have here. They can go into the facilities without previous approval, without previous acknowledgement, and make sure that everything is copacetic and that all rules are being followed. Again, that's pages 34 to 36 of the bill. Page 26 and 27 of the sub, I should say. The requirement that the cabinet issue provisional registration receipts upon submission of a patient registry identification card is eliminated. What does that mean? What the Senate had, we didn't have this in our bill, but we passed it last year. What the Senate had was if you apply for a license, while that's being considered, the person can print out their application and they are deemed to be accepted, the patient. So they could go ahead and get the medication, get the product. We don't think that's appropriate. They need to get approved. It needs to be a quick approval or denial, but you can't just apply for something and then you're deemed approved before you're actually approved. So we remove that and make it, we think consistent with what we've had in our bill for a number of years. On page 26 and 27 of the that was on page 26, 27 of the bill. Page 39 of the bill, we have a pamphlet that's going to be created that's handed to the patient, so the patient has better understanding of the medication and how the process works. And section 16, I don't have the page, but section 16 of the committee sub moves up the dates for the licensees. So our thought there is this is going live on January 1st, 2025. But if we have to wait for everything to begin, it won't be live January 1st, 2025. So the licensees can get their licenses. The cabinet can make its decisions on who gets licenses before then. So then product can be grown and all the stuff that needs tested and all the stuff that needs to happen can be done before it goes live. So the product can be sold as we intended it to be on January 1st, 2025. And that is the committee sub, Madam Chairwoman.
Okay, thank you. Would you like to make any comments on the committee amendment, Representative Bentley?
Yes, Chair Lady. The amendment adds the pharmacists as medication experts with dealing with medical cannabis. Pharmacists are medical professions with unparalleled expertise in medications, including their specs, interactions, and proper use, including the storage and administration. This knowledge is essential in ensuring that patients receive appropriate dosages and understand the potential side effects or interactions with other medications they may be taking. Patient counseling. Pharmacists are uniquely equipped already to provide counseling to patients regarding medical cannabis. That includes, with the pamphlet, educating patients on the proper use of medical cannabis, potential side effects, and precautions. Regulatory compliance. Medical cannabis is subject to various regulations and legal requirements, and pharmacists are already knowledgeable about these regulations and can ensure patients remain compliant with state laws and regulations governing the use. Quality assurance. Pharmacists can help assure the quality and consistency of medical cannabis products by assisting patients in verifying their source, potency, and purity. And pharmacists may even be available to decrease diversion and misuse of medical cannabis. Overall, involving pharmacists in the furnishing of medical cannabis helps to ensure safe and effective use of this product while providing patients with access to knowledgeable healthcare professionals who can support their treatment regimen. Thank you, Ms. Chairman.
Thank you. Okay, I am very happy with these changes. I appreciate all of the work of the bill sponsor and tightening up some of the questions that we had last year. So I feel comfortable with these changes for what that's worth. We have a question from Representative Rourks.
Thank you, Madam Chair. Thank you, Rep. Nubis, for bringing this before us and honoring your commitment. I know that this was very hard fought for legislation last year, and just appreciate your eye on ensuring that all these things are buttoned up. I did want to ask a question around Section 4, allowing private religious schools to have the right to refuse to enroll a medical cannabis cardholder if it goes against the school's religious beliefs. I do find that concerning on its face of if a child has been deemed to need that level of health care, and with the given protections that are in the bill, about how it's going to be administered, and not be exposed to the other students. I just have concerns that we might be denying a child access when, it's a significant health care need that they need that access to. And I was hoping that you could speak to that and calm my fears a little bit.
Yeah, I don't know if I'm gonna be able to calm your fears, so let me give you my thinking on it. I think the First Amendment probably protects it anyway. This is a Schedule I drug. It should not be. Congress, if you're listening, please do what you got to do and fix this. It's outrageous that it's a Schedule I, in my view. But I think the First Amendment would already protect that, and certainly the state's RFRA. So I don't think I gave anything on that when I said that religious schools have the right. They wanted to clarify it and put it in the language in the black and white in the statute, and I was okay with that because I think that's probably what the law would already allow if it is a sincerely held religious belief. So we're putting it in, we're codifying it here, but I think it's already protected by both the state and the federal Constitution.
I think that I'll be in support today, but I just wanted to highlight that as a concern that I have. I know that we often have debates around at what point do religious beliefs conflict with medical determinations, and so I just wanted to raise that as my concern.
Yeah.
But I will still be a yes.
Those are very difficult conversations, not only the medical, all across the world, but I would say when in doubt, the religious belief wins out. I think that's what our Constitution provides.
Okay, thank you very much for that. And just one last comment before it doesn't look like we have any more questions. I just want to thank you for working with the hemp farmers. I've had many, many conversations about their abilities and their expertise in this area. So I appreciate that they are being given priority.
Madam Chairwoman, this is something that I supported, but it's something that you demanded, so thank you for that. I think it's a significant improvement to the bill.
Thank you. Okay. See no further questions. DJ, please. We need a motion and a second. I'm getting ahead of myself. Okay, so we have a motion and a second. So now please take the roll.
Representative Bentley?
Yes.
Representative Bratcher?
Yes.
Representative Bray? Representative Burke?
May I explain my vote?
Yes.
I am a yes, although I'd like to continue some conversations around a few of the additions, and I particularly am fond of the amendment proposed by Rep. Bentley. Thank you.
Representative Callaway?
Yes.
Representative Camuel?
Pass.
Representative Dotson? Yes. Representative Duval?
Yes.
Representative Frazier Gordon? Representative Justice? Representative Neighbors?
Yes.
Representative Rayburn?
No.
Representative Raymer?
Yes.
Representative Riley? Yes. Representative Rourks?
Yes.
Representative Sharp?
Aye.
Representative Wilner? Representative Whidden? Chair Mosier?
Yes. Okay, House Bill 829, as amended by the committee sub and the committee amendment, passes with favorable expression, 14 votes yes, 1 no, 1 pass, and I will entertain a motion to roll the House committee sub and roll the House committee amendment into the House committee substitute. I have a motion and a second. All in favor?
Aye.
Any opposed? Okay. Thank you so much. I appreciate
Thank
your
you. 10
all of
minutes,
your work.
hopefully got you back on schedule.
Thanks. Okay, next I would like to call up House Bill 190. Representative Sharp is here, and I don't know if you have any guests with you, but okay, just introduce yourself for the record and go ahead and proceed.
Thank you, Madam Chair, Committee. I'm Representative Scott Sharp of the 100th District, and I have a sub on this bill.
We have a motion and a second on the House Committee sub. All in favor, please say aye. Any opposed? Anyone say aye? Aye. Okay, sorry, I didn't hear you. Thank you. All right, please proceed.
Thank you. The genesis of this bill started out when I was having trouble getting some medication for my family. And I finally decided I was going to go down to the local pharmacy and get it. And when I was there at the local pharmacy, they told me that it was going to be a $400 charge instead of a $36 charge. And I got on the phone with my PBM, and I said, "What's the problem?" And they were like, "Well, there's a penalty for using a local pharmacy instead of getting it mailed to you direct." And I said, "Okay, wait a minute. You can't get me the medicine on time, so I have to pay $400 for your error." And they're like, "Oh, that's the way it is." So the pharmacist heard me arguing. I got off the phone, and he said, "Listen, you're not the only person this happens to. This happens a lot." And I started thinking, okay. So I When I got off the phone, I called Representative Bentley, who in the past is a pharmacist and had owned a pharmacy. And I called a few other friends of mine and neighbors that were pharmacists and owned pharmacies. And they go, yeah, this happens all the time. And I started thinking, okay, if this is happening to a lot of people, this smells like a bill, we need to fix it. And what we've got with this committee sub is a compromise from the original bill, which is going to allow people to receive directly from the mail. But if it does not get there, it gives them the option at that point in time, after it's late, to go to a local pharmacy and get it at the same rate they would get it mailed to them.
We have a motion and a second on the bill. Do we have any questions or comments? We have one comment, Representative Dotson.
Thank you, Representative Sharp, for this bill. I do believe that we need total PBM reform, and I believe we need to address it in this committee. So I think we got one coming down the pike with Representative Bentley. But thank you for bringing this, and I just want you to know that a lot of Kentuckians are hurting today because of this very issue. And again, thank you.
Yes, sir. Thank you.
And I just want to thank you for bringing this bill before us. This is a good fix. Patients should not be penalized for a PBM's mistake. So I look forward to this reform passing and continued work on other PBM reforms. Okay. We have a motion and a second on the bill. Please take the roll.
Representative Bentley?
Yes, sir.
Representative Bratcher?
Yes.
Representative Bray?
Yes.
Representative Burke?
Yes.
Representative Callaway?
Yes.
Representative Camuel?
Yes.
Representative Dotson?
Yes.
Representative Duval?
Yes.
Representative Frazier Gordon? Representative Justice? Representative Neighbors?
Yes.
Representative Rayburn?
Yes.
Representative Raymer?
Yes.
Representative Riley?
Yes.
Representative Rourks?
Yes.
Representative Sharp?
Aye.
Representative Wilner? Representative Whidden? Chair Mosier?
Yes. Okay. House Bill 190, as amended by the House Committee Substitute, passes with unanimous support. The same should pass on the House. Thank you very much.
Thank you, Madam Chair. Thank you, committee.
Thank you. Okay. Next, we will hear House Bill 467. Is Representative Tate here? Oh, maybe we need to give her a heads up. I think that she needs to. Oh, okay. All right.
Madam Chair, I'd like to record a vote, please.
Oh, that's excellent use of time.
I'd like to record a yay vote on House Bill 11.
Thank you. Are there any other members who need to record votes? Okay. All right. Representative Tate has arrived, so yeah, please make your way to the table and invite any guests. I know that we have Abigail Brown on Zoom. If you could just introduce yourself for the record. And
where are they going?
I see former Representative Adia Wuchner is here with you. So please introduce yourselves and proceed.
Thank you, Madam Chair, and the members of the committee. I'm State Representative Nancy Tate, and I represent District 27.
Thank you, Madam Chair, members of the committee. Adia Wuchner, Executive Director for Kentucky Right to Life.
And then our guest online, would you like to please introduce yourself for the record?
Hi, thank you so much for having me. My name is Abby Brown. I am a genetic counselor at St. Elizabeth in Edgewood, Kentucky.
Thank you so much for being here. Okay, the floor is yours.
Thank you very much. I will just go through and review the bill really quickly, Bill 467, and then I'll allow my guest to speak. Section 1 would require all hospitals offering obstetric services and alternative birthing centers to provide or make referrals for prenatal palliative care. Section 2 will require health benefit plans to provide coverage for prenatal palliative care, require health benefit plans to provide coverage for this care. Section 3 will require self-insured employer group health plans provided by the governing board of a state post-secondary institution to its employees. Section 4 will require Medicaid, the Kentucky Children's Health Insurance Program, and the state employee plan to comply with the new sections on perinatal palliative care and making technical corrections. And then Section 5 and 6 requires the inclusion of this very compassionate care into the before-mentioned plans to be taken effective January 1st of 2025. So, Ms. Adia, I would turn the chair over to you if you would like to begin.
Thank you, and it's an honor to be here today. Many of you have voted on provisions of this bill in a resolution over 6 years ago, and that was a resolution encouraging hospitals in the Commonwealth of Kentucky with birthing centers to have we called it perinatal hospice then, we now refer to it as perinatal palliative care. And so we're revisiting now because 6 years have passed. And the bill then puts in place that hospitals in the Commonwealth, as Representative Tate said, would have a program. And so if you're wondering that you might not be familiar with this, and there are currently 2 programs in the state, and there is a bereavement program in the state. But perinatal care really is that multidisciplinary team that wraps their arms around a mother, a father, a family when there is a diagnosis of a life, perhaps limiting diagnosis for an infant. We have with us today from St. Elizabeth in Northern Kentucky, Abigail Brown, and I'd like her to describe, because they have a program that was presented to this committee 6 years ago and has been in existence for some time, and she's a genetic counselor with Footprints in Northern Kentucky, their program. So thank you, Madam Chair.
Hi, thank you again so much for having me here today. I'm very excited at the opportunity to be able to talk with you about this important bill and sort of the value that we see in it. So again, I'm a genetic counselor in Edgewood, Kentucky, so St. Elizabeth Healthcare. And I wanted to talk to you guys about our hospital's perinatal palliative and hospice care program. So that program is named Footprints after the famous Mary Stevenson poem. Footprints has been serving families who have delivered babies with life-limiting diagnoses at our hospital for a little over a decade at this point. Our ultimate goal with our program is to offer a continuous support and anticipatory guidance to families who are facing a lethal or a life-limiting diagnosis in order to honor and celebrate their baby in a way that is meaningful for them. By doing so, we aim to maximize a family's potential for healing during what is arguably the most difficult moment in their lives. Our program offers support to families in a multidisciplinary setting with input from neonatologists, child and family life specialists, pastoral care, and others at a dedicated meeting space. And that's meant to allow the family to ask difficult questions about what to expect, express their wishes for baby's delivery and memorialization, and receive resources from these specialties that they might not have otherwise received with standard care. Our program can also help those families who may be facing an extremely difficult decision of whether to pursue comfort care for their baby or to pursue aggressive interventions. This is a decision that you can imagine is difficult for anyone to make regarding their child, but it is one that is often faced by families in this position. And for those families with babies that may not be eligible for interventions, we really just strive to make baby's birth as smooth and meaningful as possible, with several options for memory making for the families. And we also allow families to think about what parts of the delivery process they would like to include. One part of delivery that most people don't think about is, whether or not you want to have the baby's heartbeat heard during monitoring during the labor and delivery process. Our families have to think if that is something that, they want to include as part of their delivery. And that's something that's difficult to imagine having to make. And I think that anyone who has welcomed a child into the world can attest to the feeling of anticipation and the anxiety and waiting for their baby's arrival. But how important then is it to support our families who are anticipating not being able to bring that special baby home? Thank you for your time and consideration, and again, for allowing me to speak with you. Happy to answer any questions.
Okay, we have a motion and a second on the bill. Do we have any questions? Okay. I just have a quick question and a comment. I just want to thank you for bringing this to us and for continuing the conversation about this important service. and support that's so necessary for families going through something like this. Do we have hospitals? I know that we had the resolution 6 years ago, and that was to encourage hospitals to provide this service. How are we doing on getting hospitals on board, or do we have consensus around this issue?
We have 2 hospitals in the Commonwealth, or 2 healthcare systems in the Commonwealth that do provide the programs, and there are outreach programs that are external that would that are listed for the state of Kentucky, and then that would be Norton's, and of course St. Elizabeth in Northern Kentucky, and then St. Joe's in Lexington actually has a bereavement program that could be expanded. I would share with you, if I can, I know we've called for a vote, and you don't want to interrupt that, but from a mother who had experienced this program, and when she was asked, what did it look like? What did perinatal, it was hospice or palliative care look like? And she said, it looked like love. It was a gift of time when the life expectancy was brief. It gave us time that we didn't think we would have. When we expected it to be longer, it gave us time to, and I often used to say to patients myself, you can't say goodbye until you've said hello. Thank you all.
Thank you. Okay. We have a motion and a second on the bill. DJ, please take the roll.
Representative Bentley.
Yes, sir.
Representative Bratcher.
Yes.
Representative Bray. Yes. Representative Burke. Representative Callaway.
Absolutely.
Representative Camuel. Representative Dotson.
May I briefly explain my vote? I'd just like for everyone to take notice. My colleagues on the Democratic side all got up and left. And that's an atrocity, because when it comes to these type of issues, this is very important. And I want folk to understand we're just protecting the health and life of these children. Thank you so much.
Representative Duval.
Yes.
Representative Frazier Gordon. Yes. Representative Justice. Representative Neighbors.
Yes.
Representative Rayburn.
Yes.
Representative Raymer.
Yes.
Representative Riley.
Yes.
Representative Rourks. Representative Sharp.
Aye.
Representative Wilner. Representative Whitten.
Yes.
Chair Mosier.
Yes.
Chair Mosier, if I may just make one final comment. I just
Yes.
want to comment in regards to Representative Dodson's point. I just want to point out that 6 years ago when this resolution was passed, it was done with bipartisan support. So I think this is a very compassionate piece of legislation that gives us the opportunity to support women and their families physically, mentally, spiritually, emotionally, and financially. So thank you very much.
Of course. Thank you. Okay, House Bill 467 passes with positive support, unanimous, of the members here, and the same should pass on the House floor.
Now, Chair Bocher, just one more point. I'd just like to make out, and I just made this point of order over in the state government. We have Rule 57, which was adopted in Resolution Number 2 on January 24th, that basically said that we had the opportunity to pursue the consent calendar. So while we haven't exercised that yet this year, this would have been a perfect example for that. So thank you very much.
Thank you. Okay. Representative Whitten, would you like to record a vote?
Yes, thank you. I'd like to record a yes for House Bill 190 and a yes for House Bill 829, please.
Thank you. Okay. We have House Bill 438 on the agenda, but we will pass over that today. There was a question that we need to address, and so we will take that up next week. House Bill 645 is the last bill that we will talk about today. Representative Raymer, if you are not too exhausted, please make your way to the table and introduce yourself for the record and your guest. Welcome again.
Representative Rebecca Raymer, District 15.
Adia Wishner, Executive Director, Kentucky Right to Life.
Thank you. And we have a guest on Zoom. If you could just introduce yourself for the record, please, and we will proceed.
Hi, I'm Dr. Lori Earnshaw, and I am a hospice and palliative medicine physician with Hospice Health and associate clinical professor at University of Louisville.
Thank you for being here.
And I believe we have a committee sub.
Okay, we have a motion and a second on the committee substitute. All in favor, please indicate by saying aye. Any opposed? Okay, thank you.
So House Bill 645 is basically looking to simplify and make it more user-friendly, the MOST form, which is the medical order scope of treatment. I think you all have a copy of it in the folder, and I'll let Adia talk to it.
Good afternoon again, and I will be brief. Medical order scope of treatment was passed many years ago, and we've had this form. There have been some modifications to it over a period of time. We used to have the pink copy and the yellow copy and multiple copies. You all made those changes. But when we sit down this year to look at it, along with the doctor, we were in our office. Maybe you wonder why Kentucky Right to Life's here. Well, under the law that was passed when this bill was first put in place, in this process for Kentucky, it lists a group of collaborators or partners that would be counseled before any changes were made, and our organization happens to be one of those. And so we've had the opportunity to work and make changes. One of the things, if you ever saw the old form, you'll notice that the font is a little bit bigger. It's easier to read. It categorizes all the elements of the scope of treatment so that they make sense, because these are filled out with a caregiver, the patient, their caregiver, perhaps their significant other that may be with them, and then it is signed by their doctor, and it becomes part of the document that follows them from home to nursing home to a hospital situation. I'm going to just sort of render that time. The accompanying document that was mentioned in the committee sub, basically as we met, we thought it'd be great to have just a short page explanation. So it really just outlines advanced directives, healthcare power of attorney, and defines also the Kentucky's medical scope of treatment. So it would accompany this document for patients as they begin to look at it and go over it with their provider.
I just want to stop you just for 1 second and let members know that these forms that we're talking about are in the front pages of the bill.
And you'll notice the elements of the document outline. It doesn't change, let's say their living will or their medical power of attorney, but it outlines specifically going through different elements: feeding and hydration, when to transport, when not, when to use antibiotics for the patient, which is very important, especially for those that will be providing care. I'm actually going to let our physician speak now because this is what she does every day. So,
okay. We do have a motion on the bill, but I will allow you a few minutes, and then we'll take the vote.
Oh, hi. No, thank you, Representative Raymer and Adia. All I'll say is that really this form is not substantially changed. It's based on amendments that were informed by a group of stakeholders across the Commonwealth of healthcare workers who engage in advanced care planning, and have found that the form is often filled out incorrectly, that patients do not understand it. It was not designed originally with, the optimal language for healthcare literacy concerns. And so really this is just a way to clean up the bill a little bit and make it more user-friendly and empower patients to really understand what they're signing and healthcare workers to complete the form correctly.
Okay, thank you. Well, we have a motion on the bill. Do we have a second? We have a second. Okay. Any questions? Seeing no questions, DJ, please take the roll.
Representative Bentley? Representative Bratcher?
Yes.
Representative Bray? Representative Burke?
May I explain my vote?
Yes.
This is great. Thank you so much for bringing this bill. I think it's really important that patients be able to guide their treatment, and we honor the dignity of people who are suffering. Thank you.
Are you a yes or a no?
I'm a yes.
Thank you.
Representative Callaway?
Yes.
Representative Camuel?
Yes.
Representative Dotson?
Yes.
Representative Duval?
Yes.
Representative Frazier Gordon? Representative Justice? Representative Neighbors?
Yes.
Representative Rayburn?
Yes.
Representative Raymer?
Yes.
Representative Riley? Representative Rourks?
Yes.
Representative Sharp? Representative Wilner? Representative Whitten?
Yes.
Chair Mosier?
Yes. And it appears that I overlooked someone who had a comment or a question.
It wasn't on this particular bill, but I just wanted to give an opportunity to the ones that left earlier to give them an opportunity to vote on House Bill 467. I don't want to leave them out.
Thank you. I can only speak for myself, but I believe we declined to vote.
Okay. House Bill 645 passes as amended by the House Committee Substitute, passes with unanimous support. The same should pass on the House floor. Thank you so much.
Thank you,
for your
Madam Chair.
work.
Thank you.
This is great. Thank you. All right. We are adjourned.